My role in CPC is dual. I'm a practitioner. I have an office-based practice, and my practice is CPC focused. And I also am the medical director for a physician group. And I think the difference is really seeing the role of a leader and how a leader can implement change, and then measuring the change at the practice level. And so one of the things I've seen at the practice level is that I can tell you my day-to-day functions have changed significantly since began participating in CPC. When I have a diabetic patient who comes into my office and their A1C is 11 and they need to be placed on insulin, I grab my care coordinator, we spend time with the educational process. I get that patient at home safely with information and knowledge about how to administer insulin. And these are things that would have taken me weeks to do before CPC occurred. And so I see the value of this at the clinic side, which then reinforces the things that we've done on the administrative side in the leadership role. So I think it's been really wonderful to be able to have a foot in each camp around CPC. Setting the stage for team building is really a group process, and so I think from a leadership perspective, you have to bring in all of your key leaders, and everyone has to be on the same page. And I think one of the first things we did was really build the infrastructure around group meetings and bringing all of our leaders together on a regular basis to understand our goals and to understand where we're trying to go with our value-based programs. But I think the other part of that is the knowledge and the mission, and then implementation. And so one of the things we've done, which has been very valuable to our organization, was to build a lean process and bring lean training in, and really spend a lot of time with our leadership understanding what Lean Six Sigma and lean processes look like. We've done training, and we've trained about 150 employees now on Lean Six Sigma training, and then we've begun the process of implementing that across the organization. So I think it's not just understanding the goals, but it's how do you implement those goals. And I think bringing infrastructure like that has been really valuable to our organization. We know as a healthcare system that we can't implement transformation and leave it only isolated to our office-based clinics. And so we have a wonderful leadership structure within Hillcrest Healthcare System. The CEO of our system, the CMO of our healthcare system have all been supportive and really integral to our success. And one of the values that we've had is that because we've got such a good relationship across the leadership in the healthcare system, they've been able to understand where we're going and support that, but also build our expertise and bring our expertise into the hospital systems, and really from that perspective understand how we change at the hospital level as well. And so they've embraced some of the cultural changes we've had because of CPC, and then they've integrated those cultural changes into some of the cultural changes at the hospital level. So we built our work from the outpatient setting back to the inpatient setting, but we couldn't have done that without the support of our leadership. The challenges that we deal with are the same challenges that every organization does. It's the resistance to change. And I think, we've really spent a lot of time understanding change management and understanding what change management looks like. And I think not being frustrated because change doesn't happen fast enough. I think that's some of the biggest barriers we've dealt with. We take our physician leaders who embrace these programs, and we really we engage them and we make them leaders. And our practices where we've struggled, we put more resources in their laps, and we do everything we can to show them the value of providing some of these additional resources to our high-risk patients. And so I think the biggest issue has always been that cultural transformation, and for every organization that's a struggle. But I think it's understanding the importance of walking into a headwind and knowing that you have to continue to persist and that you can't back down when you feel pressure. You just have to continue to move forward. And I think with that in mind, I think that we've gotten past a lot of the barriers that we didn't anticipate having when we first began this transformation. Alignment is a real challenge, and I think every healthcare system struggles with the same thing. You know, what is it that you can do to align not only the physicians but the staff and the management? And I think our initial alignment was really, this is the right thing to do, and I think our providers understood that this was the right thing to do, but it didn't always motivate all the behaviors we wanted to motivate. So then we really began to look at compensation models, and I think that compensation is another way of creating a really motivating alignment. And so we began to align physician compensation with our quality metrics and with our patient experience metrics, like a lot of other organizations do. But we felt that wasn't really enough, and so we've also aligned our executives' compensation. And the alignment is really almost exactly the same. They're aligned with quality and with patient experience as well. And so between all of those alignments, you really begin to see the push towards how do we change the system in a way that we can see individual benefit, but group benefit as well. And I think one of the things that we've seen as a result of the alignment is that our metrics have improved substantially. We've been able to see a substantial change in really the attitude of our executive leadership as well, because they've begun to ask the questions they weren't asking before. Why are our blood pressure control not improving any better? Why are we not doing a better job at colon cancer screening? Because now they're interested in the outcomes, and because of that alignment, I think the system is really better prepared for value-based care than it's been in the past.